The Vinci Xi platform allows us to do a variety of urologic surgeries. Most of them are focused on urologic cancers such as prostate cancer and kidney cancer.
I use the Da Vinci robot for surgeries involving endometriosis, fibroids, heavy uterine bleeding, any gynecologic indication that would have traditionally been an open procedure, we use the robot. You can use the Da Vinci robot for a variety of conditions, such as gallbladder disease, hernia repairs, colorectal surgeries. I myself prefer it for hernia. I love the robot. I think paradoxically, you would think it'd be less control, which is not good for me, but it's actually more control. More precise movements, better visualization. It's easier on the surgeon's ergonomics and longevity, can do more cases in a day. So it is one of my favorite tools.
The Da Vinci Xi system is really like a natural extension of my hands and my eyes. So when I move my hands at the control station, the robot then moves its hands just the same way, but on a smaller scale, with nice microscopic fine movements.
I think the biggest difference or the biggest benefit is that patients are back to activities of daily living so much sooner. So where traditionally you have a big incision in your belly and you stay in the hospital for a week, 20 years ago, now I send people home the same day.
And then at home, their recovery is less eventful. They're walking around shortly after surgery and getting back to their regular life.
I think that's the biggest thing, right? The downtime and the healing time may take 4 to 6 weeks, but just looks so much different and so much better.
We've integrated what we've learned from our customers and what our design teams have invented, and now we're proud to present the Da Vinci Xi. The Da Vinci Xi is our 4th generation of Da Vinci system, and it has in it over 20 years of learning how to enhance surgical performance by creating a natural extension of the surgeon's eyes and their hands.
This new product features fast 4-quadrant surgery, substantially improved vision, and is a scalable platform for all our advanced technologies. The overhead boom allows the arms to rotate as a group, and this frees up valuable space inside the surgical field, allowing unobstructed access to the patient. This is all enabled by smaller, lighter arms with extended range of motion and improved reach inside the body.
Making the system much easier to use was a primary focus of developing the Da Vinci Xi. Docking is facilitated by a laser targeting system. Point the endoscope at the surgical site, press the targeting button, and the system will configure itself into the optimal position for the procedure.
The new endoscope is much easier to use. No more draping, calibration, white balance. You just plug it in and go. With this new architecture, you can put the scope in any one of the arms, and it gives you a lot more flexibility and setup.
At Intuitive, we strive to create the safest, least invasive option for surgery. And we believe deeply that minimally invasive surgery should be the standard of care, and we work hard every day to make that a reality.
Hey guys, welcome back to another Surgical Tech Tips. Today, we're going to be talking about the robot. This is a Da Vinci Xi robot. This is their newest iteration of their robotic systems. We have an XI and an XI. We have XIs and SIs here at my hospital. I specifically just wanted to go over the XI though, because that is the newest technology, and if you're a hospital out there, if your hospital doesn't really have a robot yet, they'll most likely be buying this one if they're buying their first robot. Now, I have got a ton of stuff to talk about with this robotic system. It'll most likely be broken up into a few videos, or else it would just be like an hour-long spiel. So let's get started with kind of a brief overview of the robotic systems in the room. So the first thing I want to go over is this unit here. This is the console. This is the console where the surgeon will be sitting and operating through. Very interesting. You know, the surgeon is only scrubbed in at the table while they put the trocars in, and maybe they may like help dock the robot. But once that robot is docked and the instruments are inserted in the patient and ready to go, that surgeon will scrub out, sit down at this console, and operate the entire procedure through this console until he's ready to, you know, close the wounds and close the trocar incisions. So first part of this console we have two little eye holes right here. You can kind of see the colored bars in there. That's the screen that's inside this console. And when the surgeon is operating, that is a 3D screen. So he is operating in 3 dimensions, which is, you know, probably one of the most important things and one of the best things that surgeons like about operating in this system. They have a depth of view that you just don't have with laparoscopic cases in 2D cases. Up here we have two speakers on either side of the surgeon's ears, and also 2 mics. So the surgeon, while he or she is sitting in the console, they can talk to everybody else at the field, and there's actually a speaker system on another piece of the robotic system, and you know the surgeon can speak through that speaker system, and vice versa. There's a mic on the field and on the speaker system on the field, and the surgeon can hear the conversation going on at the field if he needs to hear anything. Moving down the console, we have these are basically just movement buttons over here that can move the plates and move the console itself up and down, depending on the surgeon's height and what's comfortable for them. And what's nice is we actually already have presets available that they can save in here, press and hold a button, and it'll automatically go back to that surgeon's preset and be ready for them. Now, these 2 little guys here are basically the most important part of the console. This is what the surgeon is going to be using to operate with. This is translating all movements from the surgeon's hands directly to the robotic arms and the robotic instruments. They have full 360-degree range of motion, and clamping, cutting, staple use with foot pedals down on the ground, bipolar, monopolar, and movement of the camera pedals all down on the ground as well. So everything that the surgeon needs to operate at the console, it's all right here. Now this is the back part of the actual robot itself. If you can see, the arms are over here, and this is the back part. This is what you're going to use to be able to drive the robot. If you are a nurse, you'll be driving the robot. But to go over, you know, how to deploy for draping, and maybe even how to move the boom and set up the boom, this is the console. This is where you're going to be doing all of that from. When you first come in the room as a tech, obviously you want to set up your robot to be able to drape it. So what's nice about the XI is it has a button that says deploy for draping, and it will open up the arms and position them in a way that you'll be able to drape it easily. So let's do that right now. Just click and hold the button. The robot will move itself into place. And it's ready to go. Stowing the robot after the day is another easy thing to do. Just hit that stow button, hold it, and it brings it right back into stow mode for you, so you can place it in the corner of the room after you're done with the cases for the day. Now, if you are a nurse and you are going to be docking this, you can just enable the joysticks specifically, and you can control the boom itself by twisting our knob here, going in and out, and increasing the boom height and lowering it. So you'll notice after we deployed for draping that we had a menu over here pop up on the left. This is kind of nice. This is kind of a specialty key to help the nurses out with knowing where to dock for the specific type of case. So say it was a pelvic case and the patient is in stirrups, patient legs, that means the console is going to be coming down from the bottom between the patient's legs. That's where it's going to be docked. Thoracic case, let's say we're doing a right upper lobectomy. We're coming on the patient's right side, directly adjacent to the patient, further up on the body over the chest cavity. So we've gone over most of the specifics on the back of this robot, except for these little handles here. This is how the nurse is going to drive this robot in so you can dock it with the patient. So underneath these handlebars are basically just two big long buttons. You push those in and it automatically drives for you. It's super, super easy. Left, right, back, forth. It has a drive mechanism built into it, so it's not super hard. Even though this robot looks like it's huge and heavy, which it is, the drive mechanism makes it super, super easy to move. Last part of the robot trifecta here is this kind of slave console. It's got a monitor directly attached to it from Da Vinci. It's not a 3D monitor, but it's a monitor amongst all your other monitors hanging from the ceilings, smacking your head on. This you'll be able to hook up your monopolar cords, bipolar cords. Your camera hooks directly into this slot here, and then it's just got some other slots for pedals and what have you, if you need them. The main part of this monitor, though, is important. Now, this monitor is the most important part of this slave console because if there are any issues that happen during a case or issues that happen with an arm, a fault will come up on the top of the screen and it'll tell you exactly what the fault is and how to fix it. Over here, we have our list of all of our arms that are connected to the Da Vinci itself, the planned cart approach. So see, I still have the thoracic, right upper thoracic case set up. Going over in the menus here, this says uses remaining up here. I don't know if you can read that or not, but it says uses remaining. So what's important about this are all of the instruments that we use in a robotic case, they have lives, and they have a certain amount of lives per instrument. It could be 15, it could be 20, it could be 50, depending on what the instrument is. And what's great about this monitor and great about this is that you'll be able to look this up at the end of the case and make sure that none of those instruments are expired or, don't have any uses left in them. We like to keep a tally when it starts getting close to, maybe like the last 5 uses of an instrument. We'll start, putting little hash marks on the instrument itself, just to let the tech know when they're opening it that it only has so many lives left. Down here, we have 4 little bars. These 4 little bars are actually the arms. And what's great about this is when you have instruments in these arms, it'll tell you exactly what instrument is in each arm and or camera in what arm it is in. Wow, so that was a lot of info on kind of a brief overview of the 3 main console units that are attached to this Da Vinci robotic system. You can go more in depth with it. That was just a really brief overview though. I hope you guys enjoyed the video. Hey guys, welcome back to another Surgical Tech Tips. We are still here with the robot, and today we're going to be talking about draping the robotic arms, and we're going to be talking specifics, everything about these arms, how to control them, how to dock them. Let's get going. All right, so first off, we're going to be talking about how to move these arms specifically, and also move the boom from the field. Sometimes when the nurse is driving the robot in over the patient, you need to move or rotate the boom. She can do it, she or he can do it from the back of the console, but sometimes it's just easier for the people that are scrubbed in to just rotate the boom as the nurse is pushing it in, getting ready to dock it. So we have a button right here on the back of this this arm shoulder. I like to call it the shoulder. I like to call this the elbow, and this is kind of like the hand. So if we hit this button and hold it down, we're able to rotate the entire boom itself. Now we have two more buttons that are attached to each of these arms. We have one button here at the bottom of the hand, I like to say, and that's going to move side to side, up and down. And a button up here that's going to angle left, right, forward, and backward. All movement directly from the elbow here. This movement is coming back from the shoulder. I almost forgot one other use for this. One other use for this back button is holding it down and pulling the arm all the way down. You'll notice it's red right here, and that's going to enable the sterile person to lower the boom or heighten the boom, all by the touch of that button. I've got one more button to talk about on this arm. It's located on the back side. Remember, we have our two buttons here, one here, but there's also a button directly on the back side of the arm. And this button is specifically for patient clearance. If after you dock your robot and you have all your instruments in place and the surgeon's moving around and working on the case, and you notice that these arms are getting close to the patient, you can use this patient clearance button to move an arm out of the way to make sure that you have enough clearance so it's not going to be harming the patient. Now what's new with the XI, which is pretty cool, is the fact that you can just grab it and you can move it yourself in all of these directions. I feel like that's a little bit more too much brute force than I'm used to, so I do still use the buttons because it's fine movements and it's easier to dock these arms with fine movements rather than just taking the whole thing and trying to, put it into the trocar this way. It's much easier with fine movements with the buttons. Now I don't know if you've noticed these yet, but there's a whole bunch of weird little red dots up on the top of these arms. These are actually magnets, and these are for draping purposes. The drape that we're going to be using is basically a big clear plastic drape. It's going to go over the arm, all the way up the arm, and there's two little magnets that you're holding onto underneath the drape that you just snap in place on each of these magnet holes here. So when looking at this robot, you would think you have 1, 2, 3, 4 drapes that you need to drape with. That's not the case though. We have a magnet right back here, and this is the column drape. It's important that you put the column drape on first. Always put the column drape on first. So I'm sorry, but I don't have a sterile setup that I can use with this, but I do have some extra robotic drapes. So I'm gonna drape out the column drape first. Now, obviously, I'm just doing it with my bare hands, so you're gonna kind of have to use your imagination a little bit here. This is our column drape when you get it on your table. We're just gonna open it up. Just like that. And this is our magnet. This is the magnet that I was talking about that it's going to attach to on the column or vice versa on the arms when we get the arm drapes. So you want to make sure that this is away from you, and I'm just going to place this right on the column. Hands are touching the outsides of the drapes. This already has, a formation of a square to be able to go right onto that tower. So I just like to hold right underneath those and put it right there on the magnet. I'm holding the outside of the drape, and you're just going to tear the tapes and pull the drape down. Always handling the outside, or the outside of the drape itself. That's the tower drape. Next is going to be our arm drape. Our arm drape it's much easier on this console, or on this robot, than it was on the SI. You're basically going to start over this arm and move up, move up, move up, move up, move up until you get to the magnets, and just put the magnets in place. This is the arm drape as you're going to get it right out of the package on your field. So it's on your sterile field. Pop this tape open and fold it out. You want to make sure this piece and this piece are facing forward when you drape this. So I like to put my, obviously this is my hand, but sterile hand, and I like to grab both of these plastic pieces together and go directly over the arm like this. Starting it on the outside and kind of dropping it and draping it over the arm itself. Next thing you need to do is, you'll notice that on the drape we have two little hands. We have a hand here, we have a hand here with our magnets above each hand. That's telling you that you need to take both of your hands and slide them in these cups. You're going to then pull the drape all the way up the arm and attach the magnet pad. It's as simple as that. Kind of pull some of the slack out. We're going to undo this tape, bring this down a little bit. And now we will attach our top plastic piece and our bottom plastic piece. It's very, very important to note that you do not get any excess drapes underneath these plastic pieces. If you do, you'll probably have a fault. It won't dock right. It won't accept an instrument correctly. It's just not good. I will take these little malleable things and I will just press them backwards to keep this drape smooth and out of the way, so it's easy to insert the instruments directly into the trocars. If this is out like this and you go to insert an instrument, you might accidentally puncture this drape and completely contaminate the instrument itself and the case. So take these malleable little plastic pieces and just push them back into the arm to keep that drape out of the way. Last part of this draping is this plastic piece that's on the back side of the drape. It's just going to slide and clamp in. Remember, try to keep the plastic out of the way, and it's just going to clamp in place to try and keep some of that slack out of the drape itself and keep it down instead of bunched up over where you're going to be inserting instruments. All right, I think I'm going to end this video here. We went over the draping and specifics of the arms themselves. The next video will probably be going over docking, inserting instruments, and docking itself, docking all the trocars and what have you. Thank you guys for watching. Hey guys, welcome back to another Surgical Tech Tips. This is the third video of this robotic series, or the Vinci Xi series. And I'm going to be going over docking the robot to the patient, and also inserting instruments and other little maneuver things that you need to know and realize when you're a surgical tech working in the robot room. So you can see we already have 1, 2, 3 trocars already in our patient here. Our middle trocar is going to be our camera, and we're just going to have two arms. So we're not going to be using all of the arms. I'm only going to be using and docking 2 of them because those are the supplies I have. Now I hope you can see this right now. There is a green laser on the patient's body right now, and the nurse is going to maneuver that green laser so the marks are directly over the camera trocar. Once the nurse is done positioning these laser lines over the camera trocar itself, the sterile person can then start to move the boom itself and angle it so it's going to be looking at the target anatomy. So let's say we're going to be working on something in the upper chest, and our target anatomy is directly above here. So I'm moving the y-axis directly looking at our target anatomy, and our x-axis is going in line with the line of our trocars across the patient's body. All right, now, so docking the robot. I like to always dock the camera first. I think it's important to always dock the camera first because you never want to go in blind with an instrument. Never want to go in blind with an instrument. So I'm going to angle the arm specific to, you know, this angle that I have on the trocar. We have a little latch here, and this latch unlocks the docking portion of the inside of this this arm. So with my index finger, I'm going to be pushing on the button behind the arm, and with my thumb, I'm pulling this lever back. That will enable me to maneuver this arm right in and let go.
Install the endoscope for targeting.
And now it's locked in place, it's ready to go. I forgot to show you, this is a disposable piece, and this hooks directly into the top of your trocar to enable you to obviously add insufflation directly down this trocar itself. Now this is an 8 trocar, so we have a 5/8 trocar head attached to this trocar. This is a 12 head, and what's nice about the 12 head is that they also come with these downsizers that you can put directly down the trocar and make it an 8. We use those a lot in thoracics when we're stapling. You know, it's nice. We usually have 2 12s, and you have the ability to use an instrument, an 8mm instrument, and then when, you know, the surgeon's ready to staple, you just take this sleeve out, slide the 12mm stapler down there, do your stapling, slide this back in, and you can dock a regular instrument again.
A few moments later.
So now that we have our caps in place and our camera trocar is docked and ready to go, we are going to insert our camera itself. This is a super expensive camera. The XI camera is really, really nice. For one reason, you hold down the light button, it turns on, and it automatically white balances itself. There's no calibration or anything that you have to do in that instance like you did have to do with the SI. No need for any of that. It's just kind of plug it in and go. So I'm going to be inserting the camera now. We're going back to the top button, and when you are inserting instruments or cameras, you don't have to hold the button. It's just a 1 tap, and you can see the light on top of the arm is blinking blue. That means you have control of this arm, not the surgeon at the console. So we can then start inserting the camera, and we're watching the scope as we insert the camera. Now let's say our target anatomy is going to be that blue pen. I'm going to hit the button one more time to make the colors go solid blue. Now this instrument cannot be moved, and it's in control of the surgeon if he or she wants to start controlling it. Now I'm going to go ahead and hit this button one more time because I want you guys to look at the screen. The screen has these green hash marks on here, similar to the laser lines that we saw initially when we were docking this robot. It's all for target anatomy. So you have the option to look at the laser lines and kind of figure out where you want your target anatomy to go and move it yourself manually, but you can also just do it specifically through this automated system that they have built in. and we're gonna be holding on, there's 3 buttons on the back of the camera. The furthest left is this circle button. I'm gonna hold down this circle button and also hold the trocar. It's gonna count down, and it's gonna move all of the arms into the optimum.
Targeting complete.
Into the optimum
Dock the
position.
remaining arm.
You can't tell me what to do.
It's gonna move it all into the optimum position for that surgery. Now let's go ahead and dock the second arm and insert an instrument. Now, I always find it important. I've seen people, you know, when they originally dock their trocar is, it may look like it's sitting further inside. So that's why it's important to always dock the camera first. You bring this camera around so you can look specifically at this trocar, and there, we can see the trocar on the screen. It's a little bit too far in. And the reason I know that is because this big fat black line needs to be just inside the patient's tissue. When that big fat black line is just inside the patient's tissue, that black line represents the pivot point that the trocar is going to be moving around. As you can see, the trocar is moving around a single pivot point, and it's right there at that black line, the big fat black line. So now that we have this optimally in with depth, we are going to bring our camera around and insert an instrument. I personally do a lot of thoracic cases, and you know, the heart is right there when you're inserting instruments, so it can be a very, very scary thing to do. And I mean, it's scary for even abdominal and pelvic cases too. You can easily perforate a valve accidentally, or a liver, you know, inserting an instrument, which are all things that I've heard have been done, you know, in the OR. So again, we're taking the head of the instrument, placing it into the trocar, and locking it in place. It's gonna go through its thing. We hit the button, and you can gently start putting it, inserting it into the patient until it's right near its target anatomy. Click it one more time, click it one more time, and now the surgeon has control of both of those instruments, the camera and the instrument itself. All right, let's say the surgeon's working, and he or she decides that you know, they need a different instrument. And that happens all the time. You're constantly swapping out instruments in a robotic case. So, to swap out an instrument, we have 2 little gray buttons on the side of the instrument here. We are going to look at the screen first off and make sure that the surgeon does not have any tissue, or you know, the instrument is not clamped on any tissue specifically. It's on its own, not gonna harm anything by taking out this instrument. So we look, everything looks okay. Push both of the buttons in and pull the instrument directly out. Now, what's nice about this is that we've already had an instrument placed in this trocar. So when you place an instrument back in this same trocar, notice that the color has changed to green, and it's blinking green. That means it has memory. So the instrument was inserted far enough through the trocar and into the patient's abdomen that it can go directly back to that exact same position without you having to maneuver the arm in any specific way. So we'll push it in, constantly watching the screen as we push it in. And it's placed. It is now solid blue, and the surgeon can use it. Now, I've moved the instrument inside the abdomen so I can show you guys what it's like when you don't have memory with an instrument. If you notice, the instrument is all the way backed into the trocar, and when I take this instrument out, it doesn't have any memory. It's a solid blue color on this arm. So when you put this instrument back in, it's not going to have any memory. Now, You can try and just go in blindly and keep it at that exact same angle that it was at, and you can do that, but it's dangerous. It's very dangerous. So I highly suggest taking your camera and moving it back so you can see the trocar. But another reason I did this is because I wanted to show you guys, if you look at the top corner of the screen, we have kind of like a yellow and black hashes. And what's happening is that those hash marks are specifically telling you where your instrument is going to be coming in when you're inserting it into the body. See, if I move it up, it's going down. Moving it back down, it's going up, and it'll insert in that area. So I wanted to do one little last segment of kind of tips and tricks that you might use in the robot room. You'll notice when I inserted the camera initially, I put it in place and slid it into the body. We have this huge long cord that's coming off of the camera, and it's pretty cumbersome. So a trick that I was taught was if you wrap the cord around the camera itself, or the shaft of the camera, and then insert it in place, you have this cord that wraps around your instrument, and it's kind of out of your way and out of this field. Another tip I have for you is for the insufflation. Obviously, when you start the case, you're putting the camera port in first, so that's where the insufflation is going to be going. But after you start docking all of these arms, it's important to remember to take that insufflation off of the camera trocar. And I'll tell you why. There's been multiple times in the past where we haven't realized why the camera is fogging up so much. You put defogger on it, you try warm saline, you try everything, and it's still fogging up. You want to know why? It's because your insufflation is going through that camera port. Save yourself the hassle and save your surgeon the hassle, and just move that insufflation over to one of the ancillary ports so that CO2 isn't constantly blowing on the tip of that camera and fogging it up. Another tip I have that I've seen some people do, it's kind of bad practice to take the bipolar or monopolar cord, you dock your instrument and then go to put that cord in while the instrument is already docked. That could be an accident waiting to happen. You can accidentally, see that? I can still push this in without even touching the button. So you could accidentally, it takes a lot to push it in, but you just want to be safe. So take the instrument out, hook up your bipolar or monopolar cord, and then place the instrument back in. It's just the safer bet. And lastly, I just want to do one more tip on the docking procedure. If you're going to be docking under direct vision of the camera itself, I highly suggest that you place the camera first and then dock one arm under direct vision, insert the instrument, move over to your other side, dock the other arm, and insert the instrument. If you try and dock all of the arms at the same time, your camera itself is just not going to have the movement that you need to look around to be able to see, the opening of those trocars. All right, I think that is it. We have done a lot of robot talking and robot stuff, and there's still a lot more information about it. It's crazy. There's a lot of stuff specific to specialties and procedures, and different instruments and staplers and blah 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 blah. There's a lot, but I hope you found these Robotic XI videos helpful, and as always, thanks for the comments and the shares, and please leave a comment below in any of these robot videos if you might have missed, if I might have missed something, or you would like to see something in some future videos. Thanks for watching, guys. I'll see you again.